Welcome to the Lifestyle Medicine Update. I'm Dr. James Machino. A really excellent review paper on Coenzyme Q10 was published in the journal Nurse Prescribing in 2013. And here's what the research article looks like. And I will tell you that it's a beauty. So perhaps some of you are already taking CoQ10 as a supplement, or you've heard a little bit about it. But Coenzyme Q10, or CoQ10 as it's known, is a vitamin-like substance that the body actually makes. The problem is that by the time we're in our mid-20s, our body starts producing less and less of it as we get older. So by the time we're in our 50s, the decline in CoQ10 status can actually contribute to the development of a host of health problems or disorders. So the key thing to understand is that CoQ10 is required to help convert food into energy in all the cells of the body. So as CoQ10 declines, our cells are less able to make optimal amounts of energy to maintain their normal or optimal function. Now this seems to be of really great importance with respect to the heart muscle. So with less available energy, the heart muscle slowly weakens, which can set us up for congestive heart failure as we get older. Now the thing to know is that congestive heart failure is the leading cause of hospital admissions in people over the age of 65 years old. So this is important. Now, of interest is the fact that a number of really well-designed clinical studies have shown that providing congestive heart failure patients with CoQ10 supplementation has helped reverse their condition and improve their cardiac function, quality of life, and these other cardiac parameters to a very significant degree. In fact, CoQ10 has been approved for the management of congestive heart failure in Japan since the mid-1970s. Now, taking CoQ10 supplements is kind of like putting the missing piston back into your car's engine. All of a sudden it starts firing again on all cylinders and you have more horsepower. So the same is true for the heart muscle. With replenishment of CoQ10, the heart muscle can start beating again with more optimal force. It's producing more energy. So CoQ10 supplementation has also been shown to help reduce high blood pressure, lowering systolic pressure by 17 points and diastolic pressure by 10 points in well-designed human clinical studies. Now it does this by stimulating the release of what's called nitric oxide from the blood vessel wall, and then nitric oxide causes the blood vessel wall to relax and allow the blood to flow more easily, and that lowers blood pressure. So CoQ10 has also been reported to help reduce plaque buildup in the artery wall as well by acting as an antioxidant to prevent free radical damage from the cholesterol floating through our bloodstream. So cholesterol that is damaged by free radicals as it floats through the bloodstream, or gets oxidized as we say, tends to stick to the walls of the arteries with greater affinity, and over time this causes progressive narrowing, which leads to heart attack and stroke and other serious cardiovascular events. So some studies suggest also that CoQ10 supplementation can even reduce the muscle pain side effects affiliated with the use of cholesterol-lowering statin drugs like Crestor and Lipitor. Of interest is the fact that statin drugs actually block the synthesis of CoQ10 in our body, and thus many doctors prescribe CoQ10 to prevent CoQ10 depletion when they prescribe statin drugs to help reduce muscle pain and muscle damage, and also to help reduce the risk of congestive heart failure. So CoQ10 supplementation has also been shown to be very helpful in slowing the progression of Parkinson's disease, also helping the management of fibromyalgia and some cases of migraines, and in certain cases it also helps reverse infertility problems in men by improving the sperm count, the sperm quality, and the sperm motility. The motility is the movement of the sperm so it can swim sort of upstream and fertilize the egg. So as pointed out in the review article, there are more than 600 articles published in the peer-reviewed medical literature on CoQ10, including at least 60 controlled studies on human subjects related to cardiovascular conditions alone. The authors of the paper conclude this: published evidence supports a beneficial role for CoQ10 in the prevention and management of cardiovascular disease, noting further that none of the clinical trial studies have reported any significant adverse effects following oral supplementation with CoQ10. And in some cases, the patients were taking very high doses, like 600 to 1200 milligrams per day. But for general prevention and health optimization purposes, I often suggest to patients that by age 45 that they consider taking at least 30 milligrams of CoQ10 a day. And for patients over the age of 60, I suggest a daily dose of about 60 milligrams a day. For patients who are on cholesterol-lowering statin drugs, most authorities suggest 90 to 100 milligrams a day to help maintain the body's CoQ10 status. Now, patients with real serious problems, congestive heart failure, high blood pressure, Parkinson's disease, fibromyalgia, and other conditions, they would require higher, more therapeutic doses of CoQ10, which really should be taken in concert with the overall medical management in these types of cases. But I've included a link to the research paper in the text below in the event that you want to learn more details on the subject of CoQ10. So thanks for watching, and I'll see you next time.